Over the weekend, there were some discrepancies in COVID-19 case numbers in Arkansas. More cases were reported than were actually diagnosed in the state. 5 News reporter Catherine Gilker spoke to the Arkansas Department of Health to figure out where the confusion came from.
The Arkansas Department of Health reported 851 new cases of COVID-19 on Saturday. But instead of the number of cumulative cases going up like you would expect, the number actually went down by more than 1,000.
We went back and we, quote, cleaned up, end quote, the data a little bit.
ADH reported a total of more than 52,000 cases on Friday, and the number went down to 51,000 on Saturday. Secretary of Health Dr. Jose Romero explains what happened.
There were also individuals that were from out of state that were being counted as in-state, and they were removed from the rolls. So the number now represents this cumulative negative removal of these cases that were positive but from out of state and any duplicates.
Deputy Chief Science Officer for the Arkansas Department of Health, Dr. Austin Porter, says some private labs give full patient information, including where they live, but sometimes they only tell the ADH the person's name, their date of birth, and the results of the test.
Unfortunately, we have enough private lab or data from private labs where it's, kind of more of the minimal amount of information that we gather. This is a dual reporting state, so these private labs, they send information to the primary care provider, and then they also send that information on to the Department of Health.
He says it's important to get as much information as possible to implement contact tracing.
Whenever we do get those positive cases in and we don't have a county of residence, we still, by default, mark them as a positive Arkansan. But when we do our mapping, we just assign them as a missing county.
The ADH says they plan on doing a data cleanup like they did this past weekend, around once a month as soon as the information becomes available. In Fayetteville, covering news where you live, Catherine Gilker, 5 News.
All right, Catherine, thanks. Dr. Romero also says there was one death taken away from Arkansas's total because the person was from out of state and received a false positive test.